Good morning, everyone. Really thank you for joining us. I'm Kathy McMorris Rogers from Washington State, and with me are a group of working moms, small business owners, as well as members that have been longtime advocates of healthcare reform. And we're here more than anything to say that it's most important for us and for America that we do healthcare reform right. I have some small business owners that I would like to introduce to you. Christiana Logan Smith, she's the owner of ServiceMaster. Amy Nichols, she's the CEO of Dogtopia. Julie Sterling, she's the owner of the UPS store. And Kristin Hawkins, who's a working mom. The reason it's so important to do it right is because, you know, when you're sick, when your son or daughter is sick and you take them to the doctor, you don't want the doctor just to do something. You want them to do the right thing. And that same principle applies to healthcare reform in Congress. We don't want to just do something. We want to do the right thing. The current version that's being pushed through this Congress by the majority is alarming to us. First, we are very concerned about the way that it jeopardizes the doctor-patient relationship. We're concerned about the additional debt, the trillions in spending that it's going to add to the children and grandchildren that will come after us. But worst of all, it's going to further hurt our small business owners at a time when our economy is in trouble and we're losing jobs. So with that, I'd like to first call upon Christiana Logan Smith, owner of ServiceMaster, to share her perspective.
I'm Christiana Logan Smith. I live in Annapolis and I own ServiceMaster Chesapeake. We clean office buildings. Over 18 years, my husband and I have built up our business. We now have 14 full-time folks and about 130 part-timers. This health care reform bill, as it's looking now, would be devastating. We would get caught with that 8% payroll tax, even though we now provide health care as an option for our full-time folks. And I don't have an extra $64,000 lying around to give Uncle Sam. Furthermore, a lot of my competitors manage to keep their payrolls very small, so they would be exempt. The only way I could continue to compete would be to cut pay, reduce jobs. We need health care, we need it done right, but it can't help some while inflicting arbitrary penalties on other parts of the workplace. I'd love to see health care reform that decoupled employment and insurance. Then Americans could be free to try to be entrepreneurs or make the employment decisions that were best for their families, not be handcuffed to a certain employer by health care. Thank you.
Great, thanks.
Good morning, I'm Amy Nichols. I own a business in Virginia and Maryland. I'm also a franchisor. So not only do I own 2 of my own businesses, I have 34 franchisees across the country. One of the big questions I get from my franchisees regularly is, how can we work together to get a better health insurance plan? Most of them have sacrificed health insurance by becoming small business owners. They left large corporations where it was provided for them. Now they have to go out and spend a large amount of money just to be covered. They can't even consider actually covering their employees. We've been offering health insurance to my employees, of which I have about 30, for several years now, half of which do not take us up on it. They prefer to save the money and just be paid. Totally lost your train of thought. So the other thing that occurred to me when we started looking at this penalty is that I really couldn't afford to cover my employees until we did about $1 million in revenue. And so for the average small business across the country, they're way below that amount. So we're really going to be penalizing them, making them make decisions such as letting go staff, and I'm sure it's going to be talking about decreasing their actual pay. If you're not at minimum wage, they're going to get closer to it in order to compensate for this additional penalty. Thank you.
Hi, good morning. My name is Julie Sterling. I'm the owner of the UPS store franchise territory for Arlington, Virginia. Prior to being in business for myself, I spent 10 years on Wall Street and worked for a Fortune 100 company. At that time, I was fortunate to have my health care paid for by that company. Now that I am in business on my own, I am very keen to the costs of health care and the ability to provide health care benefits to my employees. Healthcare is expensive, there is no question. Offering healthcare, though, as a small business owner is a great benefit and one that has helped me retain and hire the best talent. folks out there are looking for health care coverage and other benefits to keep them employed. It is a great expense, there's no question. I think I would encourage Congress to find a way to lower health care costs, not to tax the small business owner again and again. Increased taxes will not allow me to grow my business or to hire more staff. I will actually be at the point where I will be reducing my staff, and thereby there will be no health care coverage to provide for anyone. I'd rather keep my money, continue to grow my business, hire more people, purchase new equipment, and allow myself to create wealth for not only me, but for my staff and those that surround me in my business. I think there are also ways in which Congress can work to find ways to allow for preventative programs to be paid for by insurance companies. Let's get healthy before we wait till the expensive diagnosis occurs and our health care system is out of control. Thank you.
Hi, my name is Kristin Hawkins, and I'm the Director of Students for Life of America. I'm here today not only as a manager of a small business, but also as a working mother. My son, Gunnar Hawkins, was diagnosed with cystic fibrosis this March. He is 5.5 months old. It was the worst day of my life when we found out that he had cystic fibrosis. But what was even worse was when we started researching what a nationalized health care plan would do for Gunnar. We felt hopeless. My husband and I started looking at the UK and in Canada and what cystic fibrosis patients have to endure to get basic care. People with CF, their average lifespan is 37 years old. It used to be 2. Because of advanced medical treatments and frequent doctor's visits, we have been able to expand the lives of CF patients. However, in countries like Ireland, which have nationalized health care, the life expectancy is 27, 10 years younger, and this is a first world country. And this is directly attributed to their nationalized health care plan. Nationalized health care plans hurt patients with chronic illnesses because it limits their access to doctors, to medical tests, treatments, and new experimental and expensive drugs. My son deserves the right to have a long and prosperous life. And the current bill that President Obama and Congress are endorsing would take that right away from him. Delaying his treatments will take years off of his life. As a working mother, I don't know what I will have to do if this passes. There is no other country that we're going to be able to go to get Gunnar care.
Good morning. My name is Michelle Bachmann. I represent Minnesota's 6th Congressional District, and I wanted to show everyone this chart that's here. This is a chart right now that unfortunately the Speaker of the House doesn't want the American people to see. We're trying to send this out, but we're being denied by franking privileges from letting our constituents see this. The reason why this chart is so important, as a mother of 5 biological children and as a foster mother to 23 children, there is nothing more important to me than to make sure that my children have high quality health care when they need health care. Many of our foster children were special needs kids. And try and have a mother stand on one side of this chart with her children and have the medical professional on the other, and think that she has to go through the hassle factor of getting through 31 bureaucracies until she can finally access the high quality health care that her child needs. That's like having a mother bear protecting her little cubs, and she's seeing that she has to move heaven and earth to get her child what her child needs. I would do that. The mothers behind me would do that. We would move heaven and earth to get our children what they need. But this is what we're looking at if this comes forward. Any mother would have to somehow figure out how to get through these 31 bureaucracies to get the child their health care that they need. We'll do it if we have to, but why put ourselves in that situation? And we're calling on the Speaker of the House to let us send this out to our constituents and stop embargoing this information so the American people can see what is in front of them.
Good morning. I'm Judy Biggert from Illinois. You know, I think most all of us here have had the opportunity to take our kids into a fast food restaurant. We want to get a quick dinner, and you walk in, and there's 50 people there, and it seems like everybody in line wants to buy food for their soccer team or whatever. You know, the American people aren't particularly good at standing in line, but that's exactly what's going to happen if this healthcare plan goes through. Talking to my daughter in London about the UK health system, I've got a good idea what a government plan means. We checked on the wait time for various procedures. If you want to have a hip replacement, it's 9 months. If you want to have a knee replacement, it's 11 months. If you have a slipped disc, it's 5 months. Think of the pain that you go through. But checking with the doctor here under our current plan, I asked him when I could get a hip replacement. Fortunately, I don't need one, but I asked him, you know, when could he schedule it? Well, he said next week. Now, the only inconvenience that we might have here in this country is the fact that what day of the week does the doctor do surgery? So the Democrat way is not reforming health care, it's destroying it.
I'm Marsha Blackburn from Tennessee, and I want to say thank you so much to the women who have joined us. They're giving you real live examples of why health care needs to be done right, because it does affect jobs. Indeed, we know that the Pelosi-Obama plan on health care could cost as many as 4.7 million jobs in the United States. We know also that it could cost as many as 112 million Americans their health insurance. And these ladies are giving a great example from their businesses of how those numbers would come to be. 3 quick points for you. We know, we as Republicans know, we as members of the Energy and Commerce Committee know, we need to address cost, we need to address access, and we need to address accountability from insurance companies. And we have a plan for that. We have been pushing forward our ideas, pushing forward our plans. It is unfortunate that the Democrat-led House is not wanting to make this a bipartisan goal of doing health care right. Let's bring down the cost. Let's increase access. Let's hold insurance companies accountable, and let's do it using market forces, and let's do it with a plan that is patient-centered. Thank you.
Good morning. I'm Virginia Foxx from the 5th District of North Carolina. I am a former small business owner, and I know what it's like to make a payroll. I know what it's like to provide benefits for employees. And I want to congratulate the women who are here today, who are running small businesses, who are parents, who are juggling lots of things in their lives because they understand these issues. The president put out a lot of facts the other day, or put out a lot of numbers that he purports to be facts. They are not facts. We do not have 47 million Americans who don't have health care. There are no Americans who don't have health care. Everybody in this country has access to health care. We do have about 7.5 million Americans who want to purchase health insurance who cannot afford it. We do not need a plan that destroys what is good about health care in this country to give the government control of our lives. This is an issue of freedom. If the president really wants to help those 7.5 million people who don't have insurance, we can do that very, very easily. What we need is additional choices for people in this country. We need portability. We need to be able to allow people to buy health insurance across state lines. We need more freedom, not less freedom. What the president wants to do is put the federal government in charge of our lives in every aspect of our lives, and we don't need that. We can make good health care affordable to those, or health insurance affordable to those who don't have health insurance. Again, I know from whence I speak, from having been a small business owner. My daughter has our business now. We have some of those people. She offers them health insurance. They don't want it. They are young. They'd rather have the money in their paychecks. We are seeing directly the people that are a part of that number that is not true, because there are many people who can afford it who don't get it because they're young, they think they don't need it. Let's not increase the control of the federal government. If we want to help small businesses in this country and the women that are represented here, we need to lower taxes for them, reduce regulations, and put them more in control.
Thank you, Virginia. I'm Kay Granger, Congresswoman from Texas, and before I was a Congresswoman, I was a mother of small children. As an inexperienced mother, I wanted my doctor to tell me the difference in sniffles and seriousness, and so I would make those calls and make those visits, and we would make the decisions together, my physician, my children's physician, and me. Later, my mother became ill. She had a stroke, and I brought her in to live with me, and so I had to take over her health care and her decisions and fret with Medicare and nurses coming into the home sometimes. I would make those decisions, oftentimes very difficult decisions, with her physicians to make sure the health care was the best it could be. Before I came to Congress, I started my own business. I did like so many of the women that are up here, starting your business from scratch, just a few employees, built that business and owned it for 20 years. I wanted to give benefits to my employees, and most of the time I did. But I wanted to make sure I kept their jobs, and that was the most important thing. So the benefits that I could afford that they understood is what I could present to them. Today I'm an independent woman. I take care of myself. I try to eat well. I exercise. I stay as healthy as I can. I want a doctor who understands that, a doctor of my choosing, so he can help work with me so I can stay healthy and productive, making those decisions with that physician. Not a Washington bureaucrat, not someone I'll never see making decisions for my health care. I want to make those decisions along with my physician. We're getting ready to make some decisions in this Congress, decisions about your health care, our health care, the health care of the nation. We're rushing in this decision as a health care crisis. The crisis is to get us out of Washington for August. And I'm going to tell you something, I'll stay here, and so will the women behind me, as long as it takes to make the right decision, not a hurried decision.
Good morning. I'm Lynn Jenkins from the great state of Kansas, and long before I came to Washington, I spent many days at doctors' offices and emergency rooms with my kids Haley and Hayden. And as Congress works to reform our nation's healthcare system, I can't help but wonder how it will impact them. Our nation is facing record deficits, and I simply can't support a government takeover of healthcare that will limit choices and increase our nation's debt by $239 billion. I'm not sure how any of us can look our kids in the eyes and tell them we're not responsible enough to pay for the things that we're enjoying today, that we're going to send them the bill. We must look toward the future, finding ways to rein in spending so future generations aren't burdened with debt that they shouldn't have to repay. While the current proposal is not the solution, I'm going to continue to fight for common sense solutions that will empower families with the resources they need to provide health care for their loved ones and access a plan that best fits their needs. The legacy we leave our children should not be waiting lines, rationing, and a mountain of debt. Rather, we should take responsibility now to ensure they have the opportunity for a successful, more prosperous future. Thank you.
I'm Mary Fallon from Oklahoma, and all these ladies up here, whether it's Congress people or mothers or small business women, we all support health care reform. We all believe we need to lower our health care costs. We all want to have quality health care, and we all want Americans to have access to health care. But all that being said, we all believe that President Obama's prescription for health care reform for our nation is the wrong prescription for American families. We do not believe that we should take a federal bureaucrat and put a federal bureaucrat between the patient and the doctor. Right now, American families spend over $16,000 per year for a family of 4 to provide for health insurance. but with a massive new government federal program, it will increase the cost upon that family by over $460 per family by cost shifting the $1 trillion in new spending that will go into this federal government program. It's going to hit our small businesses very hard with tax increases during a time when we're suffering through an economic recession. We know that 1 in 10 people in the nation are without work. This health care plan will be devastating to our national health care system. It'll be devastating to businesses, and it'll be devastating to families.
I'm Cynthia Lummis from Wyoming, and what you see here today is a group of healthcare providers in the form of mothers, children, who are taking care of elderly parents, who are taking care of young children, who are taking care of children in college and high school, who want to provide the very best for every member of their family. The president says health care is a right, but what he's not telling you is that security in health care is a right, freedom in health care is a right, and you only get security and freedom in health care if you're in charge of your health care. I had to visit the same doctor 4 times before that doctor figured out that what was wrong with me was thyroid disease. Will that commissioner allow me to go back to the doctor yet a 4th time to figure out that I'm not making this stuff up, that I actually have thyroid disease and then can get treatment? I don't want to leave that decision to a healthcare commissioner. I want to make that decision. I want to work with my physician. That's what we want for our families, for our husbands, for our children, for our parents. That's what American women want. Not a right to health care that is limited and controlled and dictated by a federal bureaucrat.
I'm Congresswoman Jean Schmidt from the 2nd District of Ohio, and I'm a mom, and at one time I was a caregiver of my elderly parents who the Lord took many years ago. So I know a little bit about health care, and I can tell you we have the best health care system in the world, bar none. That's why folks like Kristin, when she got the devastating news about her child, could go to a healthcare professional and find the needed treatment for her child so that child can live into adulthood. That's because we live in America. But we do have problems with our healthcare system, and we know that. We know that the costs are rising. We know that many families are finding it difficult to pay their premiums, and some families are finding it impossible to get insured. And what we as moms want in the United States is to continue the best health care coverage possible, but find ways to make it easier and more affordable. This bill that is before us in Congress does neither. It will not make it easier for us because we'll have 31 different bureaucrats to go through in order to get the answer that we need. And as the Congressional Budget Office so clearly stated, it will do nothing to lower the cost of health care. So why don't we look for a plan that does increase accessibility and affordability and accountability and work to reduce the cost and continue to allow folks to live in a country that has the best health care system in the world. Thank you.
Thanks, Jean. Okay, questions?
How are you all going to spend August talking up your alternative versus the Democratic alternative? Do you think August provides an opportunity for you to turn the tide?
Absolutely. I think the more that America actually hears what are the specifics in the bill, the more concerns we hear from our small business owners, from families, and we're going to make sure that through the month of August that we can continue this dialogue, that we continue to talk with America about the right kind of healthcare reform. A healthcare reform that will be more affordable, that will provide the choices that America needs, and that address the cost drivers that are within the system. Does anyone? Okay, next question.
Thank you.
Okay, thank you very much.